Good afternoon and welcome to ESFTV. I just want you all to know that leadership has been and will continue to be laser focused on the safety of our students, faculty, staff, but also the community that our ESF campuses reside in. I have some talking points I wanted to cover here in the first few minutes, but we're really here to provide the opportunity for staff in particular today to ask their questions about the COVID-19 pandemic and the college's response to that pandemic thus far. So first of all, I wanted to discuss some questions people might have about how serious is the COVID-19 pandemic. And I thought I'd start with the data from 25 scientists from the Center for Disease Control who went to China in the middle of the worst parts of their outbreak to study the virus and its epidemiology. Their data shows that about 80% of the patients that come down with COVID-19 do not require hospitalization. Now that does not mean that they don't get quite sick. It can vary quite a bit on how sick people get, but in that category of 80% that don't require hospitalization are individuals that do get quite sick. Now 20% of the people that become infected in fact require hospitalization. 15% require being put on oxygen and 5% require being put on a ventilator. And this really emphasizes how serious this disease can be. More so, the mortality rate from the CDC data indicates that it is 3.4%, and it's concentrated in some high-risk categories. Those particularly at risk include anyone over 55 years of age, anyone with a medical condition and that is immunocompromised. Most notably, these include heart disease, respiratory conditions such as asthma, as well as diabetes and others. In short, it's a very, very high percentage of our population that is at very high risk during the pandemic. Now, is ESF overreacting? I've received a number of emails of people accusing me of overreacting. And no, we are not overreacting. In fact, the US, in my opinion, is underreacting, and that indicates that the outbreak will be much worse than what was observed in China, who were able to take very proactive measures to limit the spread of the virus. Some estimates put infections in the US at the hundreds of millions, and if that is true, it could be hundreds of thousands people that will die during the pandemic. And so no, we are not in fact overreacting. I want to make this statement and then I'll explain what I mean. Our collective behavior manifested through personal actions and decisions will determine whether we can flatten the curve. I'm going to say that again. Our collective behavior manifested through personal actions and decisions will determine whether we can flatten the curve. So what do I mean by that? What do I mean by flattening the curve? Well, in a pandemic situation, what you would normally see is a very rapid increase in the cases of disease, followed by a decrease, similarly rapid. The number of cases can become very high. As I mentioned in this case, it could be in the hundreds of millions. But the point is that if you do nothing, that is the curve, and it will very rapidly overwhelm the healthcare system, who will not be able to keep up. The idea here is if we can take a number of important measures, we can flatten the curve, and that's the curve that's shown in yellow. By taking these measures, we decrease the height of the peak and we keep the height of the peak below the stress capacity of our healthcare system, and we spread out the infection over the pandemic over a longer period of time. The critical issue here is the number of ICU beds available in New York State and Central New York, and more specifically, the number of ventilators, as one of the main differences of COVID-19 from the common influenza or the flu is the increase of fluid in the lungs, and thus increasing the need for assisted breathing devices like ventilators. If the curve spikes, like in China, Iran, Italy, we simply don't have enough ventilators to accommodate the sick. This is a simple fact of the amount of appropriate ICU facilities versus the numbers of people we expect to get COVID-19. So again, our collective behavior, what do I mean by that? Those are the efforts we have made to cancel large gatherings and to begin to depopulate the campus. Personal actions, what do I mean by that? Well, these are the decisions we personally make that put our communities at risk. And I'll use one example. I was reading the Sunday paper, noticing a number of St. Patrick's Day events are continuing, and I think that's foolish. So if your personal decision is that you're going to go to a crowded bar on St. Patrick's Day, you are putting the health of you, your family, our community, and the college, its students, faculty, and staff at risk. Similarly, the personal decision to travel right now, particularly air travel, will put you, your family, your community, and the ESF community at risk. People who selfishly continue to behave foolishly because they have decided they're in a low-risk group, which may or may not be true at all, are endangering the whole country and the whole community. I do want to update you that as of this morning, 8:30 this morning, a woman in her 70s presented at the Upstate Medical University Emergency Department and was confirmed to have COVID-19. She's 70 years old. She's currently being hospitalized with, excuse me, with no travel history. And what that means is we have community spread around us right now. There are other infected individuals in the next few hours, I imagine, which will present. So with that background, and I'm not trying to scare the heck out of you, many people who get this disease will be fine, they will recover, but those people in high-risk categories we have to protect as citizens of this country. So I'd be happy to take your questions at this point.
Great, thank you very much, President Amber. Again, I encourage people to use the chat box on the right-hand side of your screen to send me their questions. Dr. Amber. I think we should focus a little bit, President Amber, on the disease itself, and then we can talk about specifics as it relates to so can you help us understand a little bit more what the symptoms of COVID-19 are?
Yeah, so the main symptoms in particular are a fever, 2 to 14 days after exposure, a cough, it tends to be a dry cough, and shortness of breath or respiratory illness. If you see any of those, if you experience any of those symptoms, you may be coming down with COVID-19. I can hear you, Mark.
Obviously, and I think we heard Dr. Amberg. All right, so then what should an individual do if they might think they're coming down with COVID-19?
Well, first of all, you should call your primary care doctor, and it's very important you do not go to the doctor's office or the emergency room. And the reason for that is we don't want to infect healthcare facilities and healthcare workers, which will further make it difficult to handle the pandemic. You'll likely be screened over the phone by a healthcare professional to determine if you need to be tested. They will then provide instructions if they decide you need to be tested for you to go to a testing location. Currently, this is at Syracuse Community Health Center on Salina Street, but there will be more in the coming days that will be put together. Again, you do not want to go to the Syracuse Community Health Center if you have symptoms until you have been directed by a healthcare professional to do so.
Okay, great. And again, I know some people had an issue hearing me, but I think your answers was obvious what my questions were, so I believe that's all fixed. So let's transition to the workplace. Basic question, should people come to work?
If you don't feel well, you absolutely should not come to work, and if you're at work, you should go home. If you've been in contact with someone who has been diagnosed with COVID-19, you should stay home. If you live with someone that is under quarantine, you should stay home. If you can effectively do your work from home, then stay home. If your presence is required to support our faculty to prepare for the delivery of distance learning, then we would ask you at this time that you come to work. If your presence is required to support our students, and physical presence is required on campus to support our students, then at this time we ask that you stay. You should receive guidance on whether you can work from home, and we're trying again to depopulate the campus by getting as many people who can work from home to work from home. But you can receive that guidance from your supervisor to make that determination of whether you can do your work from home. Now, additionally, I would add that according to the governor's most recent executive order, as of in the last hour, I'll just quote from there, any employee experiencing symptoms associated with COVID-19 shall immediately report symptoms to their supervisor and the agency authorities, human resources personnel. The supervisor and HR official will immediately direct the employee to leave work if they are currently at work, or stay home if they are not at work, and self-quarantine as a precaution. But again, in parallel, you need to be contacting your primary health care provider.
Okay. I want people to absorb some of these answers. I don't have any questions yet. I want to encourage people again to offer up questions. I'm monitoring the screen, so think about what you just heard, and again, now is the opportunity to ask any clarifying questions. We only have a few more questions that we've prepared, so again, this is your heads up to do that in the next few minutes. It's certainly not the last time we'll be communicating with you. This is not your last bite at the apple, but please do send your questions on. We recognize that K through 12 schools are closing all over. I know this is impacting me and my family in Oswego County right now, where my daughter is a teacher in the Oswego High School and worried about how she's going to be home to be with her kids who go to the Mexico schools, which have been closed. So as a result of this, we know a number of schools have closed in Onondaga County, for instance, as well. We've received some questions such as, can I bring my kids to work? So Dr. Amber, could you address that?
Well, being sympathetic about the issues around this, we would in fact ask that you not bring your children to work at this time, because number one, it would go against our social distancing efforts. Children have a hard time understanding social distancing. It's not really in their nature. They also, an interesting aspect of this disease is, unlike influenza, it does not affect young children seriously in general, unless they're immunocompromised. And so they don't develop, children tend to develop very severe symptoms, but they're very infectious carriers. And so for these reasons, it's just not a good idea if we're trying to keep infection rate of people working at the college at a low level to have large numbers of children on the campus.
Okay, great. Before we go on to the next question that we have, Dr. Amberg, I do have a couple of questions that relate to this last issue we've talked about. This one's a little bit of a difficult question, I think, for you to answer, because it really depends on advice we get from SUNY and the governor. But if someone chooses to stay home as a precautionary step but cannot work from home, will they be charged sick or vacation time?
I think this is very much a developing issue, and we get updates of guidance, particularly from the governor's office, but also the New York State Department of Health, to deal with this issue. I think everyone understands that people need to get paid. They can't burn through all of their vacation or sick time. I think there's a great sensitivity to this issue, but we've been given no specific guidance in that particular instance of how we should handle it most appropriately. I will say that at the current time, we feel the campus is safe. But I have noticed today, as I move about the campus, that it's pretty spotty, the social distancing that's going on. So I would emphasize that all of us are safer if we all engage 100% compliance with social distancing, which is maintaining 6 feet between individuals on campus.
Okay. We have a few more, Dr. Amberg, related to this. Can we access all of our files, technology, and drives, even archived emails? And I can try to help answer this too if you need.
Well, so I think if you need to come to campus to access that kind of information, you certainly can come to campus. We're just trying to depopulate the campus as much as possible. Maybe consider coming in after hours to retrieve electronic files. I assume that's kind of what people are getting at. If they need to work from home, they need to get some materials from work. And certainly you can come to your workplace and retrieve what you need to be able to work from home.
Okay, and I know that our ITS people are working on this as well, and they're doing training, and they're offering a number of different options for folks. So I think stay tuned for more information on how to do everything that we just got asked. Okay, will mail delivery still continue on campus? I can address this one. The answer is it will, as long as the campus remains open. If for some reason the governor or SUNY dictate that we close the campus, then we're going to need to reevaluate how we will deal with mail. But so stay tuned on that as well.
Yeah, and again, right now we're trying to maintain the level of staffing we need to be able to support the faculty as they make this very heavy lift to move to distance learning modalities. And I think that's kind of the lens you should be looking at this through. We also have students here. The campus remains open. We have about 130 students still in Centennial Hall. And we, of course, have many upper level students living in the community. And so we just need the kind of minimal contingent of people, well spaced out, to be able to support the students and the faculty as they develop their online and distance learning materials.
Okay. We have another question about the definition of essential employees. And again, I can help you out with this too if needed. How many people on the ESF campus who have never been essential employees suddenly get reclassified this morning? I think the key here is the definition of reclassified. I'm not sure that's what we've done, but Dr. Amberg, maybe you could take a stab at this and I can help out if needed.
I may need your help, Mark. I'm not aware of people being reclassified, but we were kind of surprised to realize that executive cabinet members aren't currently classified, am I right, Mark, as essential employees, which, ouch, maybe that's kind of people's view of administration, but we're working on that because we certainly do think that the leadership team are essential employees. But I'm not sure about people being reclassified, but it is a very fluid situation, and, we're technically at this point in time not closing the campus. And if we do get to that step, which I hope we don't have to, then it will really crunch down to that core set of people that are required to keep, the heat on, so pipes don't freeze, and the various essential activities. But right now we're somewhere in between where we need staff to support the faculty and students to come to campus.
Right, and let me add to this, again, the word reclassification is a real formal human resources term. Nobody's been reclassified. What supervisors have done is to take a look at their workforce, to identify who are those people that we need to have on campus to continue the essential functions we have, particularly right now as we still have students here on campus, faculty on campus that are preparing for instruction next week that will go virtual. The other reason for essential employees, as Dr. Amberg alluded to, is the essential employees actually get a document that they can carry with them. So if for some reason there were roads that were closed, it is another form of identification that helps you get through, say, roadblocks or so on to get to campus. But I think if you have questions about this, please ask your direct supervisor. They will then pose the question to the people they report to, which eventually is an executive cabinet member that can consider this on a case-by-case basis. Let me go to some other questions here. Can we work on campus in shifts?
Yeah, and I would encourage that. If the decision by your supervisor is that that you need to spend some time on campus during the day, we could shift into breaking into 4-hour shifts, for example, on campus for off, and then stagger things with people within your unit, so there's as little contact as possible. So again, we can work in shifts to decrease contact, to create social distancing of 6 feet, and then remember all the recommendations we've made about hygiene, frequent cleaning of surfaces. One of the key aspects of this virus is we're told that the data is telling us that it can remain alive and infectious on surfaces for days, virtually days. And the main way of getting the virus is to get it on your fingers and touch your eyes or your face, the most common, other than droplets from someone sneezing or coughing. So very important to keep your workplace clean. If you're using, I know we have computer labs after every use, they should be cleaned with something that will remove and kill the virus. Just be very mindful of all those surfaces that people are touching frequently and making sure they're clean so that you don't transmit the virus via surfaces.
Okay, Dr. Amberg, we had a prepared question I want to go to now, and then I'll go back to some questions we're getting online, but I think this is a segue into some of the questions that we have online. Should I be wearing a mask?
And I would strongly ask at this point in time that you do not wear a mask. It's not necessary. It's not necessarily highly effective either, but there is in fact a global shortage of masks, and supplies must be reserved for healthcare workers that are in high-risk situations. We have to keep those people healthy, and right now the estimates are that there's not enough personal protective equipment if this goes on for very long, and we expect it will, to protect our healthcare workers. So only wear a mask if you have been directed to do so and have been provided with masks by a healthcare professional. But right now, private citizens hoarding masks is creating a huge difficulty for the healthcare system.
Okay. We have a related question related to the last two answers that we gave. Can we gather a small group of people together for a video discussion if we maintain the 6-foot distance rule?
Right now, yes. We would not have an issue with that. The directive is no more than 50 people, but I actually think we should be probably a little more careful than that, and certainly aim for 10, no more than 10, and with 6 feet of distance between each other, and then be mindful how you're entering the room to make sure that distance is maintained.
Okay. And we are winding down here. The questions don't seem to be coming in as rapidly, so again, kind of a last call out for folks. If you do have questions, please put them in the chat box. We have a question being asked for somebody else, a graduate fellow. If that person were picking up their physical paycheck, will it now be mailed to them, or should they just contact payroll? And I don't think we have any changes in any of those type of procedures, so I think it is smart to talk to payroll. I don't know if you have anything to say about that.
Yeah, no, I'd say, yeah, talk to payroll about that.
Okay.
We obviously want to make sure that people continue to get paid during the pandemic.
Okay. Are there any materials being shared about how to support students as they shift to being online learners? This is a completely new format for many of them.
Yeah, and so our go-to people for that are the Open Academy, and they actually have a liaison specifically for the students, and I know materials are being generated to help the students understand, and our main conduit for providing distance instruction is going to be through Blackboard. So Open Academy over this week is going to be doing a number of online training sessions, both for the students but also for the faculty to get ready for distance learning.
Okay, and also I would like to remind people, go to the web, go to our webpage, our coronavirus webpage. We're updating information there rapidly, and there's information there on this subject as well. Give me a second just to take a look here. Can ESF shift to summer hours, meaning closing at 4 p.m. as opposed to 4:30 p.m.?
I'll take that under consideration. I don't have a strong objection to that, but let's have the leadership team discuss that as soon as possible, and we'll get back to you on that. But that may be a completely reasonable request, in my opinion.
Still getting a few more questions about the definition of essential employees, and I again suggest you have a conversation first with your supervisor, and then if you still have questions about that, I suggest contacting the Human Resources Office. I think that'll help answer some of the questions that I've been receiving here. Okay, a question from, they're coming in full bore now, Dr. Amberg, so we've got a few more. A question from a faculty member: as we rework our syllabi to reflect the move online, what advice do you have to meet contact hour requirements?
Oh, that's a good question, and I wish we had a third room that we had Provost Newman in. I think he's been thinking about those issues and is probably much more qualified than I to answer that particular question. But I think basically you can make contact hour requirements in a lot of different ways, and it may be that as we move forward, we'll see some loosening of those requirements as well by the Department of Education.
Okay. Again, still some more on the definition of essential employees. Please speak to your supervisor and then HR, and we'll probably put more information on the web about this. This seems to be a critical issue, so we'll work on that during the day. A question about the satellite properties. Will our properties, the satellite properties, follow suit of the main campus, or will they follow the county's direction in which they are located? We had a meeting this morning of all the operations staff, and my quick answer to this is they'll be following the protocol that are established on the Syracuse campus. Dr. Amberg, I don't know if you have anything to add with that.
Yeah, no, I would agree with that. You know, if there's a particularly bad outbreak where one of our satellite campuses is, we might see some more stringent requirements coming down from the governor, in particular in the Department of Health, and we would, of course, adhere to those recommendations. Given where most of our satellite properties are located, they're probably less likely to be hot spots for COVID-19. The Adirondacks is pretty depopulous and might be one of the safest places to be right now.
Okay, great. A couple clarifications on the and helpful comments on what's available for online. Doug Johnston and Katrina Searing just chimed in. So we are they said this, we are updating documents used for new online students and will provide them soon. Also, just to be clear, Open Academy sessions are primarily for faculty and grad students who are teaching. They are not targeting the undergraduate students. I think that's helpful. Back to the satellite campuses, Dr. Amberg, are we allowed to freely travel to other campuses? I'm assuming that means our other campuses.
Yes. So if, for example, you want to work on your research project up in Newcomb at Huntington Forest, we aren't restricting that activity. We think it's pretty safe up there, provided, you know, if you're using the housing, that you isolate yourself from other people and maintain social distancing. We are making a special exception to the Ranger School, which is remaining in session for now. We want no visitors going to the Ranger Station. If we get disease in the Ranger School, we will have to shut it down. And so we're sort of isolating the Ranger School and the students and faculty working there to try and get them through the academic year.
Sorry, I just lost there we go, it's coming back. Dr. Amberg, I wanted to share this. We've had a couple of people thanking you for doing this. I think it's important to say that. One person, in fact, saying it's helpful and comforting, and basically telling us all to hang in there as an ESF community. I would second that. Okay, what about employees that are required to turn in hard copies of timesheets with supervisor signatures? Can we make that into an online approval? I certainly think that's something that we can work on. By the way, we're getting some good suggestions on operations, such as how we might be able to deal with mail delivery by putting boxes outside of offices. So I really appreciate that. I think these kind of suggestions coming forward will help us as we move forward, because we're all learning together, and this is a first for all of us. I don't know if you want to react to any of that, Dr. Amberg.
No, that's great. I mean, I think it's requiring a lot of creativity of all of us, and you know, we're not capable of thinking of everything. So please look for where there are existing vulnerabilities that we have not thought about and addressed, and let us know as quickly as possible, and we'll work on those things. But that's great that folks are being creative.
Okay, I've lost my audio in my ear, but I'm going to assume that you were done answering that. Will there be increased cleaning on campus? Yes, as a matter of fact, that's already happening. And again, we had our meeting this morning with our operations, our facilities staff, and that's exactly what will be happening. And if you have suggestions for areas that you think need to be addressed, please let our facilities people know that. They've been awesome, and they're doing a great job.
Yeah, and they're having to do quite a bit of extra work now because of that, and I just want to thank all of them for doing that. But we all can kind of participate in those efforts and helping to clean our work areas. I've got a thing of Lysol wipes in my office, and I'm hitting up my doorknob and my desk every now and then to try and keep my work area clean. So help out as much as you can.
And I think also take a minute to thank those folks if you see them in the hallway. They're our front line, and they are doing an excellent job for us. Okay, if libraries and other public resources close down, what is ESF's contingency plan to make sure ESF students have access to be successful to complete the coursework?
Well, I saw some information from Matt Smith, our head librarian. There's a lot we can make available through the web as far as the resources of the library. And so I know he's thinking about that. We have a number of students that are studying from home, and so we already are having to make those resources available to them. Most of the inhabitants of Centennial Hall left and went home to largely stay with their parents and work from their parents' home. So we're already supporting or intending on supporting those students, and that'll be true of those students in town as well.
Okay, question, what is the status for our work study students? Will they just be paid, or do they still have to do work for that? What can we tell them?
What we have committed to, with the encouragement of the Chancellor, is making sure that all of our work study students, even those working in the trailhead, if the trailhead were not to remain open, have employment and continue to get paid, because we know many of you are relying on those dollars to pay your rent, to feed yourselves, but also to pay tuition. And so as much as possible, we'll try to find work or alternative work for you that you can do from your home. But again, that'll be in consultation with your supervisor.
Okay. Dr. Amberg, we have a question about Centennial Hall. Can you help clarify the status of Centennial Hall? I think this relates to the newspaper article that was in the local paper yesterday here in Syracuse that we didn't evict students. Could you address that?
Yeah, so I actually reached out to the reporter about that yesterday and asked her to correct the article, and the article is being corrected online and is being, there'll be a correction in tomorrow's print edition as well. We did not evict students from Centennial Hall. We gave students a choice. They could remain or they could go home if they had a place to go. If they remained, we are asking them to not travel during spring break, because our ability to keep the dormitory open for now the 130 students that have decided to stay will depend on our ability to keep disease out of that facility. So we did not, in fact, evict anyone, although those that chose to leave will not be allowed to come back after spring break. And again, that's because we don't want them going somewhere, getting exposed to COVID-19, and then bringing it into the dormitory.
Okay, great. If people have planned vacations, will they be allowed to return to work after vacation? Will people be advised before they leave for vacation? And I can add to this too after you make your remarks.
We're strongly advising you that if you travel, that you not return to campus for 2 weeks. And that's simply very logical recommendation based on the fact that, and I'm sure you've seen the pictures of people packed in at airports. This is going to be a major way, if we keep to be behaving that way, that the disease is going to be transmitted and we will not be able to flatten the curve. So I'm a little shocked that those circumstances are continuing to be allowed, but you may find yourself in that kind of situation. And we would ask that you remain off the campus for a 2-week period to prevent spread of the disease to the campus community.
Great. Now I'll add to that again, the facilities operation team met this morning and we talked about this as well. this gets back to the definition of essential employees, and if an essential employee has requested a vacation or is planning a vacation, that could be an issue. So again, supervisors will be talking to employees who have requested vacation to work this through with each one of those employees. So again, reach out to your supervisor about that.
You know, if your vacation involves going up to a cabin in the Adirondacks, you know, we're not so concerned about that. If your vacation involves going on a cruise ship, we're extremely concerned about that.
All right. One of our people missed the beginning of the meeting. They're asking if we mentioned a timeline or is this indefinite? I imagine we're talking about status quo where we are today and the timeline for how long we can expect to operate this way, but I think we should be talking about what are the scenarios that might be happening that we're trying to anticipate in the future as well, near future.
Well, yeah, I mean, I think if you look at how how our response has evolved over the last few weeks, it's been a staged response of increasing levels of concern as we move into this. We are hoping that we can get our students, that we can do online instruction through to the period of time we need to do instruction to have all our students complete. There may come a point where we are directed to close down, and if we do that, that will become extremely challenging, and then we might be looking at some, you know, your grade is what your grade is now, and again, we'd be looking to the New York State Department of Education to give guidance on how to achieve completion if we have to completely shut the campus down. But that is the place that we could go to that we hope we don't have to go to.
Okay, we still have a series of questions relating to how people might access IT in order to work remotely. I don't think we're going to be able to answer all those now, but they're certainly very important. So, for instance, what about people who don't have internet access at home or local libraries or maybe even not hardware? And then associated with that, will there be a resource page available to assist us in how we do access distance working tools and training? So I think we will engage our ITS folks. I know Jim Som and company are working feverishly on this right now and make this information available through the coronavirus webpage, and I imagine also through the ITS webpage too, CNS, well, let's just say our IT people will be doing this. And Dr. Amber, I don't know if you wanted to say anything about that.
Yeah, I think that's something we have to look at carefully, and it may be that we can find a more isolated workplace with a workstation for you on campus. I don't know if Jim Som's team have laptops that can be checked out. Perhaps we have some capacity in that regard. I know many libraries you can check out laptops, but I'm going to guess they're in pretty short supply right now.
Okay, pretty direct question. Any confirmed cases at ESF?
No, no confirmed cases at ESF that we are aware of. But again, the woman that's been hospitalized at Upstate clearly wasn't traveling and got it from the community. So we know there must be infected people in the community that have yet to been identified.
Okay. A question about potentially splitting up work shifts. What about the availability of a second shift for families with two working parents who are now looking at kids being home during the day? And again, this I think directly relates to some of our facilities operations staff. Indeed, we did talk about that this morning as well, and I think as we're speaking now, our supervisors are talking about what kind of options we have there. So in this case, I would suggest talking to the facilities operations supervisors to talk about a variety of different options that we're looking at.
Yeah, I think that's a great idea, and we ought to be able to do things like that.
All right, another pretty direct question here. If it's a possibility that the students' current grades would be their final grades if things get worse, can someone let them all know that now so they realize the implications?
Well, I mean, again, that's kind of the worst case scenario. We hope we don't get there. And I might be concerned if we message that loudly. There could be negative consequences to that, to be honest.
One of the people listening in let us know that both Comcast and Spectrum, two of the biggest internet providers locally, have announced they're offering free internet services for families and students who are impacted.
That's great.
A related question, can our desktop computers go home versus purchasing more laptops? Will desktop units connect to home Wi-Fi?
You know, as long as we document you're taking it home, if it helps you work from home, I would be supportive of that approach. And you know, I don't want to completely overwhelm our IT people, but they would be able to advise you on how to make those units function with your home internet connection.
Okay. Give me a second here. Statement, the turnaround for a test of COVID-19 is approximately 2 days. Would someone, I think it's supposed to be, would someone who was encouraged to self-quarantine have to spend the entire 2 weeks out if they tested negative?
Well, right now the testing capacity is quite limited, and testing is only being done on individuals that are presenting with symptoms, or we might be concerned has had close contact with someone that is confirmed to be tested positive. That might change, but it's not like you can just go to your doctor and ask to be tested. And a comment on the 2 days, that was the turnaround time when samples had to be driven from Upstate Medical University to the Wadsworth in Albany, and then the results came in 2 days. The actual time for the test completion, my understanding from what they're bringing up to speed at Upstate is about 40 minutes. And so I think you would probably find out in the same day. And a perfect example is the woman that presented at Upstate at 8:30 in the morning was confirmed later in the morning. So that test is much more quick than, particularly since it's being locally done now, and testing capacity is being ramped up as quickly as possible. But to be honest, the country was not very proactive in getting ready for this and providing the amount of testing materials that are required. So it's a little bit of catch up, but it's not like you can just walk in and ask for a test.
Okay. This is, all these questions have been important, clearly, but this one is, I think, maybe one of the most important. Are there any staff resources for decreasing stress and anxiety over reporting to work?
Oh, that's a great question, and I think we should work on that. You know, I personally find meditation very helpful. If you don't know how to meditate, it's not that hard. I know that the Zen Center in Syracuse provides stress reduction every Wednesday evening, I believe. Bill Cross does stress reduction sessions you can go to. I don't want to completely overwhelm the Zen Center, but that's a service that I've availed myself of during particularly stressful times myself. But I think that's something we should follow up on, and we could probably provide some additional tools for that. And I thank you for that question, actually.
We also have our employee assistance program. Again, contact our Human Resources Department about this as well, and they have a whole list of other resources that we can make available. I'm just trying to make sure I didn't miss any. What should workers who have come in contact with coworkers who have recently visited densely infected areas such as New York City, Westchester County, what should they do?
Well, I think you could certainly call the COVID hotline and get some direct medical advice for that, which has been set up at Upstate Medical University. You can find that number, I believe, in my last president's message, and they could give you advice about that. I suspect what they'll tell you is, you know, just monitor yourself for symptoms and practice good social distancing. But no need to get overly concerned at this point.
Sorry, I don't have, so I'm just kind of, here we go, I got it back. A couple of really good suggestions here about the previous question, the one before the one I just asked. There are online meditation options available, a number of different resources online. I think that's a great suggestion. All right, what if an individual's significant other is a medical professional that works the front lines, an MD, nurse, etc.?
That's a great question, and I would assume that the employer of the health professional would probably be giving advice about that. You know, I'm not sure that I'm qualified to advise on that, but that might be another good question to pose to the people staffing the COVID hotline. I mean, we're really hoping the healthcare workers don't get it, but of course what we've seen in other places, and just I think recently in the United States, there are 3 ER docs that have come down with COVID-19. So I recognize your concern is real. I know they're going to be very careful at Upstate that not a lot of staff or health professionals are in contact with people being cared for COVID-19. So there's going to be sequestering them in particular units in the hospital and walling off those units and limiting the number of staff, nurses in particular, that are in contact with those patients so that they can maintain a healthy workforce.
Right, and I think this also supports the whole concept of depopulating and de-densifying and flattening that curve. Who should we reach out to if we have students concerned about their ability to finish classes with a passing grade?
Well, that would probably be their faculty advisor would be most qualified to assist them with that. You know, I guess my personal advice would be to bear down and make sure that that doesn't happen. And, you know, you got probably a little more time on your hands right now because you're social distancing, so maybe study a little harder.
Okay. We have no more questions, so I'll give people one last shot if you have something you want to type in. And in this period of waiting, I just want to say I wish you all could be here to see how they've got us set up. It's pretty awesome. And our ESFTV studios are a great resource if you haven't used them, but we actually are in separate rooms here, and I think the team here has been doing a great job putting this broadcast out for everybody. We've gotten quite a few thanks and appreciation, and I'd like to thank everybody here as well. Let me see. Again, more items online. I think those of you who are on the YouTube channel can see the comments coming in on how to get free meditation services and apps. But Dr. Amberg, I don't see any other questions at this point, so I didn't know if you wanted to make any final remarks.
Well, I just, again, I really appreciate all your hard work, your patience with this. It is just truly trying times in trying to balance doing the right thing, and I feel that we have done that at ESF, and we'll continue to try and do that. And you know, I just ask that you be well, you take care of yourself, take care of your families and your loved ones, and be careful. Nothing like a nice hike in the woods to help you relax, which is what I do. So that's another tool for you.
Okay, thank you. And everybody, we will continue to communicate via other modalities, so be looking for some more communications from us via email and campus news and other venues. Thanks everybody for taking some time out today to listen into this important message.
Yes, thank you.